The impact of residence time has been shown in cell experiments. Here, an inhibitor with a short residence time lost efficacy quickly over time after washout at low concentrations. And kinase inhibition was only sustained at high concentrations. In contrast, an inhibitor with a long residence time sustained kinase inhibition over a longer period of time, even at low concentrations.
In contrast, a dry cough does not bring up any mucus. This is why a dry cough may be treated with medicines that suppress the cough reflex. Treating a wet cough with mucolytics aims at helping the body liquefy mucus and transport it out of the airways.
Natriuretic peptides are released directly from the heart or the vessels to induce vasodilation and thus unload the heart. As the natriuretic peptides are degraded by the enzyme neprilysin, the beneficial effects of the natriuretic peptide system are limited. Therefore, blockade of neprilysin is a promising treatment approach in heart failure. However, neprilysin inhibition alone is not sufficient, as neprilysin also degrades the powerful vasoconstrictor angiotensin II and its precursor. The resulting increase in angiotensin levels outweighs the benefits of enhancing the natriuretic peptide system.
A human cell, when influenced by various environmental factors, can deviate from its normal function. The fate of the cell is often controlled by the localization of proteins. They affect the cell differently depending on their location, for instance in the nucleus or in the cytoplasm. XPO1 is a critical transporter, which shuttles over 200 different proteins from the nucleus to the cytoplasm. Many pathological conditions alter the function of XPO1, thus interfering with the normal cellular localization of proteins.
Some problems are difficult to discuss, even with a doctor. David knows because he's suffering from erectile dysfunction. His condition is threatening his sex life and his relationship. He's relieved to find out that PDE5 inhibitors can help solve his problem. But his doctor tells him that because he has type 2 diabetes, they need to be careful in choosing the right treatment option.
Recent scientific findings from a large-scale study have demonstrated that co-infections with coccidia and roundworms are highly prevalent in well-cared-for puppies between 5 and 15 weeks of age, a time when their immune system is not yet fully developed.
Most of us are familiar with headaches. Whether from stress or a cold, they usually go away when we take pain medicine. For JD, it's not so easy. She's suffering from migraine. Her headaches are severe and hard to treat, and they disrupt her daily life. She regularly has to stay home when she gets migraines, and is afraid of losing her job. To find relief, she needs to be alone in a room without light or noise, and can't spend as much time with her family as she would like to. She feels lonely and desperate. Her medications often don't help at all or cause severe side effects. She needs new treatment options,